So how do you decrease patient no-shows in your practice? Well, in this video, I'll share with you steps you can take to cut your patient no-show rate in half. Hey guys, I'm Dr. Ryan Corte, and this is Ryan Reflects. On this channel, I share with you self-improvement content that can help you thrive personally and professionally. If you're new here, hit that subscribe button. Also, throughout any point in the video, check out the notes and links in the description below. When a patient no-shows to an appointment, it affects your ability to serve another person and negatively impacts your practice's bottom line. In fact, the impact is so huge, I did a video on impacts of no-shows in the healthcare industry I'll link to above. So let's get to it. Here are the best ways to decrease no-shows in your practice. First, get patients in for appointments as soon as possible. The longer a patient waits to be seen, the greater chance they're going to look elsewhere for an appointment or lose interest in coming. If you're booked out several weeks or even months, add another provider to your team or adjust your hours of operation to accommodate patient demand. Next, confirm appointments early and often. Strongly suggest that you use multiple forms of communication and reminder methods. Text message has been king for the last few years. Automated texts work really well. Automated emails are also very good. Postcards, still impactful for that annual reminder. And then of course, a personalized phone call to connect with the patient over the phone. And every patient, well, they respond differently to various forms of communication. I have plenty of patients that if you leave them a voicemail, they won't check it. I have some patients, if you send them a text message, they're not gonna read it. So having a number of different ways to connect with your patient and communicate with them and remind them of their appointment is the most impactful. Also, beta test different communication cadences. What I mean by that is if you're gonna have a patient, they've been on books for a month, test out if reminding them a week before and then a couple of days before, maybe the day before, even a couple hours before is most impactful. Or what's gonna work for your practice? How should you remind the patient? How frequently and how far in advance? Test those things out and see what works the best. Next, switch to a digital intake form. Digital intake forms are awesome and they help streamline the patient experience, the check-in process. You can gauge though if a patient isn't gonna show up if they haven't filled out that intake form maybe a day before the appointment or even the morning of the appointment. Of course, some people will show up and they still haven't filled it out, but it's a good predictor if they may not show up, particularly if you weren't able to confirm their appointment or maybe some of their demographic or insurance information wasn't adding up. As an added bonus, this decreases the amount of time the patient is in the waiting room, improving their experience at your practice. Next, verify insurance before the appointment. Insurance dictates a lot in the healthcare industry, and when a patient understands that their insurance is accepted at your practice, they're more likely to show up to their appointment. Honestly, this takes a pretty proactive staff, but it significantly improves office efficiencies and the patient experience. You do me a favor, if you're getting value out of this video, hit that like button. Next, communicate exam fees before the appointment. Be as transparent as possible with your office fees. Patients appreciate it. And guess what? We're living in a world that has more and more information at the tip of their fingers through their cell phone. They can go ahead and review a number of different places and see what the fee structure may look like. And if you aren't transparent up front with what your pricing is, they're gonna go elsewhere. And in certain healthcare niches, I understand this isn't always possible, but it is well received by patients who are scared of or fear that they can't afford the cost of the visit. Next, highlight the office no-show policy. If you don't have an office no-show policy, I recommend you get one. It sets boundaries and educates the patient on, hey, here's what's gonna happen if you cancel last minute or if you don't show up to your appointment. For example, one that we have in our practice is if a patient doesn't confirm their appointment within 24 hours of their appointment, that appointment slot opens up to somebody else who is interested in being seen at that appointment time. In fact, I just did a video on the reasons why patients don't show up to appointments. I'm gonna link to it right above. Next, educate the patient on the importance of the appointment. This one is really for providers to do on the front end for established patients on, hey, if you're talking to a patient, you're having them follow up, maybe it's in a week, maybe it's in a month or two, let them know why. Why is it important for them to follow up? What's going on with their health and how can you best serve them? And why should they show back up to the appointment? Take the time to do so and also pay the fees associated with coming and seeing you again. Next, thank the patients that promptly show up. The lifetime value of a loyal patient is huge. Thank and praise those that are consistent, that show up on time, that are respectful and responsible. Depending on the practice and how much control you have over these circumstances, you could even put together a reward system and rewarding people for coming back and being consistent with their appointments. So what steps are you taking to decrease patient no-shows in your practice? Let me know in the comments below, and stay tuned for my next video where we can reflect and grow stronger together.